I'm Ursula. I'm 42 years old and I live in Seattle, Washington. But I grew up when I was little on a farm. We didn't really know what we were doing in terms of being farmers, but we had some great animals and great pets. And my favorite dog was named Sheba. This farm was wonderful. Some of the things that happened there were farm life and not as beautiful. And then we pitched into this series of moving. All told, counting up the number of schools I went to, and depending on how you count them, between 12 and 18 schools that I've gone to. Definitely a time period where I struggled and didn't have many friends. And I think, kids' brains in those situations spend a lot of time in sort of like a sea mess of stress, cortisol, emotions, anxiety. And I just remember feeling not at ease ever. I eventually did really well. I was captain of 2 or 3 sports teams. I was student council president. I was the homecoming queen. I was the queen of our town. I think those things happened in part because you learn over time when you have so many situations to adjust to, so many moves, how to get people to like me and to be okay, to be accepted, right? There was that intense focus, but also did it in a very exhausting way, not sleeping very much, not eating healthily, those type of things all, I think contributed to eventually being really depressed. By the time I got to college, I was still struggling with, perfectionism and concerns about, if people didn't like me, what did that mean? So the first time I went to a counselor, and I remember that counselor, I think maybe our second or third session, I, put makeup on, got dressed up, but was completely the worst I'd ever felt, and showed up and she said, "Oh, you look so great. You look like you're doing better." And I felt like I couldn't say no, no, I feel out of my mind. Yeah, so I was really interested in mental health and would do all this research on how to get over eating problems and how to understand emotions. And I didn't necessarily have a special interest in suicide at first, but I definitely had an interest in people whose emotions were so intense that it was driving them to do things that they, wouldn't otherwise do. And I found out there was a woman at the University of Washington whose name is Marcia Linehan, who's been my mentor for the past 20 years. And what was so cool, I thought, about what she was doing is that her treatment was focusing on emotions versus focusing on, thoughts or behaviors. I mean, it did that too, but I thought that was so neat. And I moved out and worked with her for many years. And then I went away, and I will have to say her style of teaching is much different than I think most other people are getting in their graduate programs. Meaning I was prepared in a way for the world that the world was not prepared for me.
The way I met Ursula Whiteside is I was not having a great day, I remember this, and I had one last meeting. I was looking forward to go home, and in walks this blonde hair, feisty Ursula Whiteside. And she had her arms full of binders. She had a bag on this arm, and I remember a bag on that arm. And she's going, "Well, I hope you guys have done some good work." At the end of that meeting, I was kind of good. I said, "What's going on with you?" She's like, "Well, I'm really doing a lot of research around suicide. And these things don't tend to go very well. And I just wanted to see what y'all were doing." And I said, "Well, I'm not even in charge, but I want to be wherever you are. Because for the people that we're working to serve, they need somebody like you in the room too." Then, of course, she took over and made it what it was and did such a fabulous job. And that's how we met. And we've been friends ever since.
For me, it's always been just really beneficial to be supportive of Ursula and her work whenever I can. I know that she's been through hard times in her life, and my job, I was her project manager for a while, and I basically kept her projects going when things came up and things got a little hard, and she made that possible. She's always vulnerable and allows people to help her, which helped me too.
So one of the really neat things about working in Marcia's lab, I moved there I started when I was 20, was the sheer amount of material, new learning there was, ways to manage emotions, move through emotions, understand emotions. And this was like, I was like eating at the buffet. I was like, this is the best thing ever. And I shoved as much as I could into my brain. Our training was very much about, you look at a system, you figure out what the problem is, and you address those problems. I think partly what was so hard for me was I was thinking like, oh, people are going to really appreciate this and they're going to love it. And no. So sometimes yes, sometimes no. I don't think I'm the only person to cue in on this and the health systems that I was working in and that they were working in. That we certainly sometimes were doing more harm than we were doing good, I think. We were blowing it a lot of the time because we didn't have a way to connect them with the care that they needed. It was a real struggle to find a therapist who would meet with people after they left the hospital, and very difficult to make sure that care was appropriate for somebody who just made a suicide attempt. In fact, there was really an unwritten rule of don't take a patient who's just attempted suicide. So I had that on one hand of like, wait, but this is like what works. And then on the other hand of they don't want it, and actually they probably don't even like me. That was a hard thing to reconcile, I think. And I'm seeing people whose lives actually were impacted by it. People can talk about this, but are they sitting with the person who's going through the thing? And I think that just drove me nuts a little bit. Like, I couldn't reconcile those two things, and I think it's it's just a common thing, but it seems so unjust.
I think she's had a serious journey. I think she was somebody who was brilliant anyway and took her whole life, this one precious life she has, and applied herself and applied herself and applied herself. And it took a toll. So I'm pretty sure she's come close to the bone of the experience. And by that I mean the experience of people who are suffering so deeply they said, I don't know if I can go on. So I won't go so far as to say it takes one to know one, but she has a level of empathy that I think many, many people in our field, and probably thank goodness, back away from. They stay just far enough away from the ledge, but she's peeked over it.
I think I started having that experience in 2009 after I left Marcia's lab after my training. It would be difficult for me to sleep. I would lose lots of weight. I would feel so anxious that I would act pretty funny in group settings. One time it was after my brother's birthday party, and I had gotten back together with a boyfriend that I really didn't want to get back together with, and I was working in the health system seeing us do sometimes harm. And I think over the course of that evening, I had a bottle of wine. That was the first time I drank a whole bottle of wine. And I remember thinking, like, I don't really care whether I live or die. I'm not scared. And almost immediately I thought, wait, what? Like, what am I doing? It opened my eyes to the experience that my patients were having, people that I loved had had. All of these experiences, always for me, this is how my brain and other people's brains work. It was just like, what can I learn from this, and how can I translate it into something useful that I can teach other people? Like, what's the story here? And I was pretty much willing to go through almost anything to come up with something really useful. I still have times that are really hard. Even in the last few weeks, I've had more difficulty sleeping and less, motivation to get work done. And then also I've had, really nice times intermixed with that. So I think, like for many people, this will be something I manage my whole life. The strategies that I learned when I first started working in Marsha's lab, I still use every day. Marsha would say, there are skills designed to help you build a life worth living. One of the strategies is called opposite action, and for me that is looking at a situation, noticing what my urge is, like what is it that I want to do, and then asking myself, like, oh, is this actually what's in my best interest? And if not, what's the opposite? It is possible to do this even in the very worst moments, especially if you start with something small. The times of hope in my life can often be described as maybe things could be different. A lot of things have not been as I had hoped, and when I see a little twinkle, I always have the thought, maybe things could be different. And I like living in that space where I believe things can be better and things can be different. Marsha Hand published her memoir. It's really the story of her life, her pathway through hell, and how ultimately she built a life worth living. There's a quote, "You know what you need in your life, but you don't know how to get what you need. You have good motives, but you don't have good skills. I will teach you good skills. Believe whether you believe or not. I'll tell them it may be difficult to believe, but believe you must. You can do that."